Hello, welcome to Stroke Tips. We're going to talk about intracranial bleeding today. Stroke tips are for medical professionals. We provide useful information within a few minutes. Acute stroke can be divided into two types, hemorrhagic and ischemic. For hemorrhagic, we're going to talk about it today. For ischemic stroke, please see the other video. At the emergency room, when acute stroke is suspected, we get a CT scan of the head without contrast. And if it does show bleed, we'll proceed with the following differential diagnosis. The next question is, where is the bleeding? What caused the bleeding? Is it a surgical or medical problem? Does it need emergency neurosurgical treatment? The first question is, where is the bleed? Before we do that, we'll look at the different layers of the brain. Under the bone, there are meninges. Meninges can be divided into dura, mater, and arachnoid. Look at the picture and look at meninges, dura, mater, and arachnoid. Dura is the layer, the membrane, right under the bone. The first kind of bleed is epidural bleeding. It's usually caused by trauma. It seems to happen in younger patients and is an arterial bleeding, and it's usually a neurosurgical emergency because it is an arterial bleeding. While subdural bleed can be caused by a minor trauma, it's usually seen in older patients, and it can present it as acute or a chronic subdural hematoma. And the patient may have very minimal symptoms. These are CT scan example of a subdural and an epidural bleeding. On the left-hand side is an epidural bleeding. You can see the blood is usually a convex shape. On the right-hand side is a CT scan of a chronic subdural hematoma. And on the top part of the hematoma is a gray dark color. That means it's chronic. But on the lower part of the subdural hematoma is a higher density. It suggests of a more recent bleeding. And let's look at the membrane of the brain again. Now the layer under dura is the arachnoid. Arachnoid means a spider web. And on a CT scan, a subarachnoid hemorrhage is usually caused by trauma or an aneurysm rupture. You can see that the blood on the CT scan is usually distributed close to the cortex. And the next major category of intracranial bleeding is intracerebral bleeding. What that means is it bleeds inside the brain. And there's a primary intracerebral hemorrhage and a secondary intracerebral hemorrhage. And let's look at the primary intracerebral hemorrhage. There are two major types. One is a Loba hemorrhage. A Loba hemorrhage is usually close to the surface of the brain, and need to consider amyloid angiopathy as the cause of the bleeding. Another type of bleeding is in the basal ganglia and sometimes in the cerebellum, and these are more commonly caused by hypertensive vasculopathy or from chronic hypertension. This is a CT scan of a basal ganglia bleed. The basal ganglia bleed is shown as a white color density on the CT scan. consider hypertensive vasculopathy as the cause of the bleeding. Another type is a Loba hemorrhage. Loba hemorrhage is close to the surface of the brain. It's outside the basal ganglia area. It can be caused by amyloid angiopathy. And for the intracerebral hemorrhage means bleeding inside the brain. Other than the primary intracerebral hemorrhage, we can also have a secondary intracerebral hemorrhage. Secondary intracerebral hemorrhage can be caused by arteriovenous malformation like AVM or from a tumor. It can also be caused by cavernous malformation or infective endocarditis. Well, in summary, intracranial bleeding means bleeding inside the skull can be divided into extracerebral and intracerebral, that is bleeding inside the brain tissue and outside the brain tissue. For the extracerebral blood, we have the epidural, subdural, and subarachnoid blood. And for the intracerebral, that means the bleeding inside the brain tissue, we can divide it into lobar and basal ganglia bleeding. And this is another diagram of the types of bleeding. Look at subarachnoid hemorrhage is usually caused by aneurysm or trauma, and the blood is right outside the cortex. And the next kind is basal ganglia bleed. Is bleeding in the basal ganglia area is usually caused by high blood pressure. And Loba hemorrhage. Loba hemorrhage is usually caused by cerebral amyloid angiopathy, rarely caused by venous infarct, tumor, or AVM, or vascular malformation. This is another diagram to show us the different types of brain. On the upper left-hand corner is an epidural hematoma. This is usually caused by a severe trauma. Number 2, subdural hematoma is usually seen after a minor trauma and in older individual. On the left lower corner, number 3, subarachnoid bleed is usually caused by trauma or aneurysm rupture. And number 4 is a intracerebral hemorrhage. It can be caused by amyloid angiopathy or hypertension. Well, thank you very much for your attention, and we'll see you next time. Bye.